I'm Neil Gerrard, Principal Dentist at Clifton Dental Studio in Bristol, here to provide you with some information regarding our sedation referral service for children and teenagers. For the past 4 years, myself and the experienced team of dental therapists have been providing RA sedation, relative analgesia, or what we prefer to call happy air, to young children and teenagers for a range of dental treatments. Now, RA sedation is a great tool to manage dental anxiety in both children and adults alike, but particularly in children and teenagers, we use it routinely to prevent dental anxiety and phobia developing in the first place. Now, RA sedation is typically suitable for children 4 to 5 years of age and older, creating a relaxed environment for a child to experience pain-free and stress-free dental care. Now, it's great for all treatments, but particularly those which are more invasive or take longer to complete than just a small GI restoration, for example with hand excavation. So, for example, the placement of stainless steel crowns on deciduous teeth, which is the gold standard for any treatment of any lesioning involving more than one surface. It is also ideal for extractions for both deciduous and permanent dentition. But in my experience and my team's experience, it is truly transformative in the use of extractions for orthodontic treatment. We commonly hear our anxious adult patients stating that they were fine with dental treatment before they had their teeth removed for braces, so this is when it's really helpful. For any of you that don't have experience completing extractions on teenagers, it can often be very testing. It is also a time in a child's development when it is very easy to create anxiety, hence why me and the team routinely use it on children who would probably accept treatment for extractions even without sedation, but we do want to prevent that experience from scarring them in the first place. Now, RA sedation comes with very few contraindications for use in children. One critical factor is they must be able to breathe through their nose. It's how the gas is administered. They must also be at an age where they do have some understanding or concept of what is happening. So for the majority of younger children, those children which are 4 to 5 years of age or maybe 6, we do provide some desensitization therapy before moving to any treatment, just to get them comfortable with the environment. Now, as a referral practice in Bristol, it's important that we as a team maintain your trust as part of any referral relationship. And as such, we promise to treat your patient as if they were a member of our own practice. We promise to provide your patients with ethical advice. We promise to be completely transparent in relation to our fees. We promise to keep you in the loop so you're always aware of the treatments we proposed or the treatments we've completed. And probably the biggest promise of all is we will promise to not steal your patient. We return them to your care following treatment unless you request otherwise. You may have some patients that you say, please keep these patients and treat them because they are very anxious and it's the only way they can be managed. But like most dentists, including myself, I would want those patients returned to my care. And I've been on the end of this myself as well when I've referred patients, particularly to specialists, only to find that I've lost the patient and they don't get returned to me. I don't want to be a dentist with a reputation for doing that, so we will keep very strict guidelines in the fact we will return these patients to you. We want your patients to be completely happy, and it's not just for what I say regarding that. Here's a video of one happy parent following RA sedation. It was a removal of her son's lower first molar tooth at about the age of 9 due to occult caries, which is a really big molar tooth, hence why we offered the service.
Hello, my name is Juliana. I brought my 9-year-old son for a specialist extraction here with Neil. The extraction had to be performed under an RA sedation, and I cannot recommend the treatment enough. He came in quite fearful, quite worried about what was going to happen. He'd been warned by another dentist that it was a big extraction and would be quite difficult. And when we got here, the nurses were extraordinary. The atmosphere was extremely calm, extremely professional, and put both me and Dylan at ease. In fact, Dylan was extremely happy. The sedation itself was brilliant. He still has no real recollection of what happened, even though, of course, he was fully aware all the time. He could speak and communicate with the dentist doing the extraction. The extraction was quite complicated and it took quite a long time. And so I was expecting Dylan to be in quite a lot of pain afterwards, and we were advised that maybe he would be in pain. But the following day, Dylan was completely pain-free and didn't take any further medication. It was actually fairly miraculous, and to this day he speaks about this practice as being brilliant and how unstressful it is, and how much he recommends it as well to other friends, and he says things like, you should go to the practice up the road, they are brilliant. And so I too recommend it. I recommend it very, very highly. I feel very safe here. I feel that my children are treated with real care. I feel that the procedures done are not unnecessary. In fact, they're really expert and brilliant. So thank you very much.
So after watching that video and considering what I've already said, if you feel it is beneficial to manage your child's experience in order to treat existing dental anxiety, or more importantly prevent the development of dental anxiety and phobia in the first place, then please consider a referral for RA sedation to Clifton Dental Studio. For an up-to-date fee guide or for further information, you can call or email us on the contact details below, or if you're already ready to refer at this point, please complete the attached referral form as well, and my team will contact your patient directly. Now, both me and the team look forward to helping you provide your patients with the care they deserve for lifelong healthy teeth, and thanks for watching.